myself Nikhil HOSMANE. I am one of the second year medical students. Today I am going to examine your eyes and test your vision. Is that okay to you?
Yes.
Okay, we'll continue the process. We are going to test vision acuity test in the using Sneddon's chart. Do you wear any glasses?
No.
Okay. Please stand here. Take the card. Please stand here. The patient is 20 feet away from the Sneddon's chart. Please cover that to your left eye, and from the right eye, please read as far sentence as you can in the Sneddon's chart.
E F P T O Z L P E D P E C F T E D F C Z P F E L O P Z D D E F F O T E C L E F O D P C T.
Okay. Can you please cover your right eye and please tell what you can see to the left eye?
E F P T O Z L P E D P E C F T E D F C Z P F E L O P Z D. That's it.
Now I am going to test your visual fields. Please look into my eyes, and when you see my fingers, please tell yes, and when you disappear, please tell no. Can I see my fingers? Is it disappear?
No.
Okay. Can I see my fingers?
Yes.
Does that disappear?
No.
Can I see my fingers?
Yes.
Does that disappear?
No.
Okay. Now I am going to assess your extraocular movements. First, I will be seeing normal conjugate movements. Please follow my finger. Okay. Now I will be looking for nystagmus. Please follow my finger. Okay. Now I will be looking for lid-lag movement. Please see my finger. Okay. At last, I will be looking for convergence movement. Please see my finger. Okay. We will continue with next book. Now I am going to assign your eyes physically and visually. Please look into my eyes. Palpating eyelids and eyebrows. Looking for any swelling. Please look up. Sclera, looking for sclera, bulbar conjunctiva, papular conjunctiva, eyelids, examining eyelids, lenses, pupils, checking for pupillary size. I'm going to shine the light into your eyes. It will be little discomfort. If you feel any uncomfortable, please let me know. Okay? Please look into my eyes. Please look into my eyes. Looking for a pupil reaction to the light. Okay. Now I am going to darken the room to continue the release. Look straight into me. I am going to reflect the light to your eyes. Okay. Now I am going to access your ocular alignment movement. Please look straight to me. It will be a little uncomfortable, please. Now I am going to use ophthalmoscope. Please look into my shoulders, around the wall. I'm going to keep my hand on your eyebrows. Please look straight. Checking for red reflex. Going to check for optic disc, which is covered by physiological curve. Optic disc is noting optic disc color and shape, and cups size. Inspecting retinal vessels, artery and vein. Please look into the light, please. Okay. Please look into light. Noting for and surrounding by macula. Okay. Please relax. I'm going to check your another eye. If you are okay, I'm going to check your one more eye. Please look straight. Noting red reflex. Optic disc surrounded by physiological curve. Noting the color of optic disc, size of the optic disc. Please look straight. Please look straight. Okay. Noting for retinal vessels, arteries and veins. Please look into the light. Okay. Inspecting fovea surrounded by macula. And checking for any hemorrhages or ampoules. Okay. That completes the procedure. Thank you.
I am SRIVASTAVA Pragati, a medical student. What's your name?
SRIVASTAVA,
How old are you?
35.
I will doing a mouth examination. Are you comfortable with me?
Yes.
Okay. First of all, sanitize. Wash your hand. Then put a gloves. Please open your mouth. Okay. Close it. Your lips. First of all, we see the lips and your color of lips and submandibular jaw and supramandibular jaw, parotid gland. Okay, open your mouth. Okay, put your touch and open it. This is sideway, this right side, left side. This is the right side. This is upper, lower gingiva, and this is upper gingiva. Put your head on straight. Okay. Please put your tongue on outside. I depress it outside. Put your hand outside. Okay. I depress it. This is parotid gland. This is a soft palate, light palate, pulvinia, alba. This okay. Put your tongue is right side. See. Put your tongue is left side. See. Put your tongue and see this saliva. Okay. Please put your. Then put your tongue outside. Okay. This very tough redness and rough. Okay. Put your finger, I will try submandibular gland, submandibular, sublingular. Performing the lungs examination. Examination of the lungs is best performed with patient sitting down and body at the rest. Now I have inspection the lungs. Inspection can be already healed side of the form permanently condition such as barrel chest caused by emphysema. Additional diagnosis include an altered respiratory rate, an imbalance between inspiration and expiration, and high of dizziness. Now palpation. We have to check palpation. Placing on the thumb at about level of 10th rib side, then silently just enough raise and hold the skin and between the thumb on the spine. Please inhale and exhale. Now we have to check the tactile formative of bronchial patient. Please say the word 99 loudly. 99 बोलिए.
99 loaded.
99 बोलते रहिए.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Now you have to percussion. Percussion help stabilizing whether the underlying tissue air filled with a filled. Now you have to percussion. Ask the patient in head distance between thumb and during respiration. Now start cranially, then noising accordingly. We have to put the finger, middle finger, and stick the finger. Percussion help you stabilizing whether the underlying tissue, air filled, fluid filled, and fluid. Starting chronically and they medley accordingly until between both heads. If lower thoracic area percussion is conducting to lateral dullness, and percussion can indicate effusion, for example, tumor. Now you have to check the resonance. Now I have to check the auscultation. The most important test when examination lungs is auscultation. The patient is breathing irregularly and through the mouth. It follows same pattern Esculation allows the vasculation of breath, its sound, which can be decreased or increased. The ratio of inspiration or expiration should be noted. Esculation also reveals the other abdominal, such as dry wet cup. Esculation across the upper way, bronchial way sound, which has a higher pitch in comparison over the pulmonary tissue to our considered pathologic hint and present of pneumonia. Thank you.
Hi there, my name is Gayatri. Can I know your name?
Sai Ganesh.
Okay, Ganesh. I would like to examine your neck today. It will involve looking your neck and feeling some of the glands and structures of your head and neck. Is it okay with you?
Okay.
Okay. Have you noticed any lump on your neck?
Yes. Here.
Okay, I will examine now. Can you open your shirt buttons and widen your tissue? Okay. Where do you find the lump?
Here this.
Okay. Is it? Is it? Now I am feeling some arms around your neck. Tell me if it caused any pain to you. Now I am checking the palpate and lymph nodes. And submandibular lymph nodes. And paratracheal lymph nodes. And anterior cervical lymph nodes. And supraclavicle lymph nodes. And pre-post auricular lymph nodes. Lymph nodes. And occipital lymph nodes. Okay. Now further, is it the lump?
Yes.
Okay. Does it cause any pain?
No.
Okay. Now I am checking the palpate mass, size of one location, edges, consistency, temperature, and skin changes. Can you please turn your neck left, right, straight? Now I palpate. Okay.
Stop this.
Now I am gonna listen it with the stethoscope. Thank you for that. It's the end of the examination. Thank you.
Thank you.
On the examination of Sai, he was comfortable at rest and there were no signs on general inspection for further examination of the neck. And I have noticed a 1 centimeter smooth muscle in the right sided posterior triangle of the neck, and I pressed for the palpitation. The mass was smooth, freely movable and not attachable. The overlying skin or underlying muscle, it was non-tender and there were no changes to the underlying skin. And the mass was not positive and even a bruise. And if I talk about my differential diagnosis, it would also considered an epidermal cyst or lymphoma. Thank you. Hello, this is Gayatri. Can I know your name, please?
Sai Ganesh.
Okay, Ganesh. I have been asked to examine the thyroid gland in your neck. Would that be okay?
Okay.
Okay. Please bring your hands towards me. Okay. Okay. Can you lay up? Now I am going to lay a piece of paper on the hands. Piece of paper may make a tumor more noticeable. Okay. Thanks. Turn hands over me It's no sweating. Now I will feel your pulse. Okay. Now we gonna do with the face examination. Face examination. Now I am not going to look more closely at your eyes. If you pick a point on the wall behind me, okay? Now I look from the side. Now I look from the side and I look from the behind. Now we gonna do eye movements. Follow my finger. Tell me if you see double vision or pain. Okay. Now I insert the neck more closely. Okay. Drink some water. Hold it and swallow. Stick out your tongue. Now I am just gonna feel your neck as well. Now I begin palpation at thyroid cartilage. The palpation at the thyroid cartilage. As you move downward, you will reach the superior edge of the corticoid cartilage. Below the corticoid cartilage is the isthmus of the thyroid gland. Palpate the isthmus and then assess each thyroid lobe individually. Ask patient to produce their tongue. Ask patient to swallow. Assess symmetry of thyroid lobe elevation. And swallow. I'm just going to feel. Palpate local lymph nodes for evidence of lymphadenopathy. Thank you. I am now gonna feel your windpipe. It might be a little bit uncomfortable. I am now gonna tap on your chest. Finally, I am gonna listen. Now I am gonna listen. If you could just take a deep breath and hold your breath. Breathe in, hold. And breathe normal. Now I will finish up with some special test. Roll up your trousers so that we can see the legs. Finally, you could stand up by crossing up your arms. Okay, relax. We are done with the examination. Thank you.
JVP examination, jugular venous pressure. To examine the JVC patient, the patient should be lean in the 45 degrees spine position and the neck muscle should be slightly towards the left side. Can you move ahead to the left side? Now, here you can see the landmarks. You can see the pulses. This is the external jugular vein pulsations. You can see the pulsations here. And this is the internal jugular vein pulsations. Okay. Now we will measure the height from the sternal angle. This is the sternal angle. Now we need to measure the height. Place one scale should be the perpendicular to the ground of the sternal angle. And now I am seeing the height. Height of the JVP. I am facing this horizontally to the ground and I am reading of the vertical scale. And the readings of the JVP of this patient is 2.5. The JVP waves are the waves. Outerward is the positive wave, and if it is going medially, it is the descent, X or Y descent. Thank you.
Hi there, my name is Gayatri. Can I know your name and date of birth?
Sai Ganesh, 29/9/2001.
Okay. I have asked to examine your cardiovascular system. This will involve feeling some of your pulses and have look at your face, mouth and chest. Listen to your heart and sounds. Does that sound okay?
Okay.
Okay. Are you comfortable? Are you feeling comfortable right now?
Okay.
Okay. Now I am going to have a look from the end of the bed. Sai looks comfortable, doesn't appear short of breath, and I can't see any surgical scars. Around bed I can't see any medicines. I can't see any ECG equipment. Now I'm just gonna have a look at his hands. Can you please place your hands like this? On the inspection of the hands, I see hands feel symmetrically one and the fingernails do not have any sign of tie staining and I can't see any splinter hemorrhages. Could you please bring fingers together like this? Yes. And there is no sign of finger clumping, and turn hands over and there is no sign of anemia. And now I'm gonna feel your pulse. It's regular and 60 beats per minute. There's no sign of any radial delay. And do you have any pain in your shoulder?
No.
Now I'm gonna lift your arm up in here, testing for a collapsing pulse. And collapsing. And there is no collapsing pulse. Okay. Now I observe for the jugular venous pressure. So could you turn your head to the left and look up at the corner of the room? And there is no sign of any rise of JVP. Now I am gonna feel the patient's carotid pulse. So could you just turn your head back towards me and then lean your head back gently. And the carotid pulse has a normal character and acute volume. On closer inspection of the face, there is no xanthosoma around eyes and no corneal abscess. Now I am gonna gently pull down the eyelid. There is no parolar and its conjunctiva. There is no malor. Flush on the cheeks and lips. Look well focused. Can you open your mouth and stick your tongue out? You can. There is no central cyanosis and good oral dental hygiene. There is no angular stomatitis at the sides of the mouth. On a closer inspection of chest, this is no midline sternotomy, inferior clavicular or lateral thoracotomy scars. And there's also no obvious chest wall deformities. Now I am just going to have a feel on your apex vest. Is that all right? Okay. And mid-clavicular line is normal. Now I am going to listen your heart. Is that okay? First of all, listening for the apex beat. Lean your head back so I can feel your carotid pulse. Identify the first and second time stones. Listen first to the mitral area and a tricuspid wall. And the pulmonary wall. And an aortic wall. Lean your head back. Now I am gonna listen your neck so you can hold your breath there. Hold your breath. Breathe in. Breathe out. Breathe in. Breathe out. There is no sign of any carotid bruise. And can you sit forward for me? Sit forward for me. Can you take a deep breath? Breathe out. And I can't listen any signs of aortic regulation. On auscultation of heart, I could hear normal first and second heart zones with no added sounds, no carotid bruise. Can you sit forward for me? And now I am going to listen the bottom of the lungs. Breathe in, breathe out. In, out. And there is normal vesicular breath sounds, no added sounds, crackles or whistles. Now I am gonna feel the bottom of your back. There's no safe edema. I could also check, you can kneel back. I could also check for any edema around the ankles. The edema isn't present. Examination is finished. Thank you.
Hello doctor, good morning. I am Seeman Vignesh. I am from MD, second year from September batch. I have been asked to perform a abdominal examination. Is it okay for you?
Yeah, okay.
Yeah, okay. And for your information, this video going to upload in YouTube and seen by doctor. Is it okay for you?
Yeah, okay.
Yeah, okay. What's your name?
Uttam Singh,
And what's your age?
21.
Yeah, okay. Let's start with the hands.
Yeah.
And before starting the examination, I want to know whether your stomach is empty bladder.
Yeah, I am.
Yeah, okay. Make him lie and place the pillow, head and knee. Are you comfortable?
Yeah, I am comfortable.
Yeah, I am place the shield and knee. Now I am going to raise your gown below the nipple and above the xiphoid process. Now if you have pain or point me those areas.
Okay.
And now I am inspecting for abdomen, any scars or striations, dilated veins, rashes, or ecchymosis found. I am also inspecting of the sympathetic counter of the abdomen. Now I am observing the counter located at the umbilicus. There is no since inflammation or flux as the paris or aortic palpation visible in the epigastrium. Now warm your hand and stethoscope. The sound is good. Now I am listening the bowl sound by placing each quadrants. The everything sound is fine. Listen the abdomen sound before performing precaution because these maneuvers after the frequency of the bell sounds. The acrolysis you may hear the normal stomach crawling. If a patient has a high blood pressure or arthrosclerosis disease, listen the epicardium over with the aorta. Then listen the iliac artery and the femoral arteries. And everything sounds fine.
Okay.
Now I am going to percuss the abdomen and assessing of the distribution of the tympani and dullness. Now I am going to percuss of the abdomen and I am observing distribution of the tympani and dullness. The tympani is a high-pitched musical sound. They indicate the hollow pitches and air and gases in the stomach or intestine. The dullness suggests fluid under the slightly in the liver plane. The dullness suggests fluid under the slightly liver in the plane. Okay, deep breath and just to the relax. If you before I am doing, do you have any pain? Get any pain? See, before I am doing, do you get any pain? No. Now I am going to palpating the fourth quadrant of the abdomen gently. Take deep breath and deep slow. Take.
Yeah, okay.
Please and just relax.
Yeah. Okay.
Now I am going to deeply palpating for your four quadrants. There is no mass or tendons found and there are also signs of acute abdomen of the inflammation peritoneals. Okay. Now I am doing the liver examination. I am precious of the spine liver first and locate the midline. So I am starting the level of umbilicus and right upper quadrant. I am precautions of the lower towards the liver now. Now I am identifying the lower border of the dullness and midclavicular vein. Now I am placing my left hand behind the lower thorax, lifting 11 and 12 ribs over the soft hip strains. Now I am placing the right hand on the abdominal lateral rectus muscles. Well done. Below lower border of the liver dullness. Just deep breath.
Okay.
Now I am starting placing palpate to the close right costal margin. Please take another deep breath.
Okay.
Next, I identify the upper border of the liver dullness. Starting from the nipple line, I am precious downward in the midclavicular line until the lung resurgence, soft liver resurgence. Now I am measure the distance between the 2 points to assess the liver contents. The liver is not palpable. Place your left hand to the right rib cage and strike it. Do you feel sensation?
Yeah.
Now I am going to do the spleen examination. The spleen is largest in the anterior and down the medially. The size each over around the palpating with your left hand to the left lower edge of the rib cage overlying the structure. Place your right hand below the left costal, present to your finger towards to the spleen. Take deep breath. Now the tips of spleen palpating for the present of the normal adult. Take from the right. Side with the leg flex at the hip in position, gravity may bring the spleen towards forward. Up to the right in the palpable location. Now I am going to do the kidney examination. First, palpate the left kidney. Move the patient's left side, placing my right hand behind the patient's just below the parallel to the 12th rib. With your finger just reaching the CVA. Placing my left hand generally the lower upper quadrant laterally and parallel to the rectus muscles. Now take deep breath and peak is inspiration. Pressure your left hand at the peak of inspiration. Pressure your left hand firmly and deep into the lower upper quadrants. Now take deep breath out and stop breathing. Slowly release the left hand, feeling at the same time the kidney slide back to the expiratory. Now I am going to palpate the right kidney. Palpating the right kidney. To the capture of right kidney, return to the patient's right side. Using the left hand, lift up from the back and my right hand feel the deep in right upper quadrants before the same view. Acquisition the right kidney is more anterior and must distinguish from the liver. Precious to the tenderness kidney, pressure from my finger and maybe enough elected tenderness. Place the ball of the one hand in a CVA and strike it with it and ulnar surface of your first. Take deep breath. Okay, slowly return for me. The aorta plus the upper abdomen slightly left to the midline. Now I am trying to assess the width of the aorta. Press the genitally each other side's aorta. Try to estimate with it normally and press and normally it less than 3 centimeter. Yeah, it's almost done. Make a press it. Precaution tendons of the kidney. Now patient's sittings assess the protest vertebral angles of the tendons. Pressures from my fingers may be enough to elect the tendons. Place the ball your left hand costal vertebrae angle in turn at the strike out with the ulnar surface the fist. Special techniques. With the practice, you also able to utilize the special techniques for assessing the possible. Include the practice outwards, several directions from the central area of the tympani. To addition technique for the testing, shifting to the dullness and practicing border of the dullness with the patient's spine. And now testing for the fluid waves for tapping one with fingertips. While other feeling folk or opposing fight for impossible transmitted to the fat individual for more body flat it's to hand for this test. You should also be able to assess for the possible appendicitis by the searching carefully of force tendons called McBurney point. It lies 2 cm anterior superior spinous process from the ilium and lie down from the umbilicus. Okay, thank you, doctor.
Hello everyone, this is LIKHAMA, medical student. So in this video I am going to do shoulder, hand, wrist and motor examination of upper extremity. Today I am going to take your shoulder examination. So may I know your name and age please?
My name is Rakesh, I am 27 years old.
Okay. So first of all, let's do hand sanitizing. Now can you please take off your t-shirt? So now we will do shoulder inspection. So there is no any scar, no redness and no swelling. Now I preparation the here sternoclavicular joint and here is a clavicular bone and here acromioclavicular joint and this is the head of humerus and here is the deltoid muscles. So now palpate also the scapula both side. Do your hand flexion like that. Up. Do you feel any pain?
No.
No? Okay. Move around. And now you will do extension. Do you feel any pain?
No.
Okay. For adduction, like that. Do you feel any pain?
No.
Other hand. Do you feel any pain?
No.
No. Now for abduction, like that. Do you feel any pain?
No.
Okay. Now for the internal rotation, and put your hand opposite of the scapula. Do you feel any pain?
No.
Other hand also. Do you feel any pain?
No.
Okay. Now for external rotation, like that. Do you feel any pain?
No.
Okay. So now we will do special maneuver test, near impingement test. Do you feel any pain?
No.
Okay. So other hand. Do you feel any pain? Okay. Now we will do Hawking impingement test. Do you feel any pain?
No.
No. Okay. So this hand. Do you feel any pain?
No.
Okay. We will do drop arm test. So place the hand flexion and now slowly drop it down. Do you feel any pain? No. Okay. Do empty can test. His hand up and downward. Do you feel any pain?
No.
Okay. So now we will do infraspinal test. So do you feel any pain?
No.
Okay. We will do the wrist and hand examination. So now inspect the hand. Here is no scars, no swelling, no skin color change, no deformities. Please put a word. Here also same, no any swelling, deformities and no any color, nail color change and the skin. So can you elbow? Now back to the elbow. Now palpate the radial pulse, and here the ulnar pulse. Same will continue to the other hands. Now we will do the sensation of the hands. So please close your eyes. So now I will touch your hand and tell me. Did you feel?
Yeah. Yeah.
Did you feel?
Yeah.
Okay. Same with the continue other hands. So did you feel?
Yeah.
Now did you feel?
Yeah.
Okay. Same with the other hand. So I will squeeze the carpometacarpal joint, and this is the metacarpal phalangeal joint, and here is the proximal internal phalangeal, and this is the distal internal phalanges, and this is the proximal interphalangeal joint, and this is the distal interphalangeal joint. So same continue with other hand. Now we will check the range of the motion of different joint with like this. Now the flexion, so like this. Move like, now move like radial. Do you feel any pain?
No.
We will check the range of the motion of fingers. So like do this, abduction. Do you feel any pain?
No.
Now we will check the range of motions of thumbs. So please like do this, and try to touch to the fifth finger, and like this abduction. Do you feel any pain?
No.
Now we will check your renal signs. So give me your hand. I will touch here and tell me where you feel the pain. Do you feel any pain?
No.
No? Okay. Same with the continue with the other hand. We will check the Allen test. So please do like this. This is the reverse final test. So do you feel any pain?
No.
So now look like this final test. Do you feel any pain?
No.
Okay. Now we will going to do motor examination of the upper extremity. So can you please take off your t-shirt? Now we will inspect the hand. So there is no redness, no swelling, no deformities, and there is no atrophy. So now checking the muscle tone. We will check the muscle strength like this. And now flexion, and like this, flexion, elbow flexion, elbow extension, and now with the wrist flexions, adductions. Do you feel any pain?
No.
Same like with this one. Tension. Do you feel any pain?
No.
No? So everything is look like normally. Thank you.
Hello sir, my name is TEJASVI. I am a second year medical student. Your name please?
Venkateswar,
Your age?
58 years.
Okay. Today I have been asked to examine your knees. So for that I need to inspect your knees, palpate and then examine.
Do you have any pain before? Yes. Okay, that's fine. Let us sanitize ourselves first. So I'm now gonna feel your knees. Is that okay with you? Okay.
Okay.
Okay. Let us check the temperature of both knees, so that if there is any increased temperature of knee, that means there is an inflammation. And then palpate the knee with the straight leg. Pause. Patella tap. This allows us to look if there's any large joint effusions. Medial meniscus. I will going to check your tibia and femoral joint. I will look for any tenderness or swelling. For any tenderness, that means there is some partial tear. I will check for the lateral meniscus. And then I will check for lateral condyle. Collateral ligament and lateral collateral ligament. Checking for the range of motion, extension, flexion, internal rotation and external rotation. Performing special maneuvers. First one is McMurray test. It is to evaluate individuals of tear in meniscus of the knee. Tear in the meniscus may cause a pendulated tag of meniscus, which may become jammed between the joint surfaces. The second one is the Drawers test. The examiner has to grasp the lower leg with both hands, with the thumb resting on the tibial tuberosity. This test is to test the ability of the ACL, anterior cruciate ligament. So pull the tibia forward. For the posterior cruciate ligament, push the tibia backwards. If the tibia has more movement or the ligament is loosed with the other knee, the anterior drawer test is positive. The next is the Leishman's test, which is a passive accessory movement test of the knee performed by identifying the integrity of the anterior cruciate ligament. This is the varus stress test, which shows a lateral joint line gap. If a test is positive, it occurs when the pain or excessive gapping occurs. The test is performed at 0 degrees and 20 to 30 degrees of angle, so the knee joint is in the closed packed position. Now I am going to examine the motor examination of the lower extremities. As I have already introduced myself, I am going to proceed with the process. Here we have few points to remember. We have to check bulk, tone, power, response, jerk, reflex, and coordination and gait. To check the bulk, we need to measure from the tibial tuberosity to 15 centimeters down, and here we need to see the diameter and check the circumference, and we have to do same with the other leg and compare. Next we need to check the tone of the muscle. For tone of the muscle, we need to palpate the muscle. Movement, we need to roll the leg and check the movement of the knee. And check the movement of the ankle. Jerks. For that, we need to ask the patient to flex his knee in the tendon. For the knee, we will next see the plantar response. For that, I am taking the key
and go in this direction. This is the response. Next we'll see the coordination of the legs.
Checking the coordination. Thank you.
Hi, how are you? May I know your name, please?
Yes, sir.
Okay. Myself, MONISHA. I am second year medical student. Today I have been asked to take your cranial nerves examination. Shall I proceed with that? I need you to cover your one side of your nose. Breathe in. Okay. Next, another side. Okay. Now close your eyes. Close your one side of your nose. Can you identify this one? What's this?
Coffee.
Okay. Another side. Can you identify this one? What's this?
Coffee.
Now it's patient visual acuity test. Patient should be 20 feet away from the chart. Close your eyes with the card. Can you read the fifth line?
E P O D C F O.
Okay. Trace into another eye. Can you read sixth line?
D P C Z L F T.
Okay. And now it's visual field test. Yeah. Can you close your right eye? Look into my eyes and I'll be moving my fingers. If you see it, can you say stop?
Stop. Stop. Stop.
Okay. Another eye. Look into my eyes.
Stop. Stop.
Okay. Now it's ophthalmoscopic examination. I will be looking into your eyes with this ophthalmoscope. Is it okay for you?
Okay.
Now it's direct light reflex. And look at straight into my eyes. Now it's consent and test. I want you to focus on this pen. Okay. Focus on my finger. Okay. Now let me start with trigeminal nerve. I'll be using a cotton swab and a toothpick. I'll be pointing it on your face. You have to tell me whether it's sharp or soft. Is it okay? Close your eyes.
Stop. 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 Stop.
Now I'll be checking your corneal reflex. Look straight into my eyes. Now I would like to check your muscle strength. Can you clench your jaw? Okay, move your jaw left and right. good. Open your jaw. Resist again my fingers. Good muscle strength. Now we will go with facial now. Can you close your eyes? Open your mouth. What taste did you feel?
Sweet.
Okay. Okay. Now raise your eyebrow like me. Some more. Okay. Now close your eyes tightly. Don't let me open your eyes. I want you to frown your face like me. Okay. I want to wrinkle your nose like me. Okay. Now smile like this. Okay. Now pop your cheeks out like this. Okay. Thank you very much for your cooperation.
Welcome.
I am SRINIVASAN, doing MD second year in University of Perpetual. Is Mr. Alex Taylor. He is my friend. He is willing to perform the test on him. So, are you interested? Are you willing?
Yes.
For this physical
Yes.
examination on you?
Yes.
Thank you. First, I am going to do cranial nerve 8 vestibular cochlear function test. For that, I am using the tuning fork 512 Hz. I am using 512 pitch tuning fork. I am going to perform the Weber's test. Do you hear the vibration symmetrically in both ears?
Yes.
Okay. Now I am going to perform the same test as a REENA test. I am going to place a tuning fork on the bone behind the pinna. Tell me once the sound gets disappear.
Yes.
Now?
I think you did.
Okay. So in the Weber's test, if he is not getting symmetrically on both ears, if he is getting louder in one ear, that ear is full of blocked wax by other serum deposit. So in Weber's test, the tuning fork vibration is more louder in affected ears. And bone conductivity always lesser than air conductivity. That is perform whisper test. So I'm going to whisper a few alphabetic words standing behind you. You have to just repeat the words.
A, B, Z, 1.
Okay. Now I'm going to repeat the same thing on your left side.
S, H, X.
Okay. The whisper test is positive, is able to hear what I'm going to the cranial nerve 9 and 10, glossopharyngeal and vagus nerve. We are going to assess both the nerves at the same time. First, we have to take a pen torch. So, can you turn this side? Open your mouth. Say look up. Say So I can see the soft palate which is elevating and arch it behind the uvula is symmetrical both sides. In case if it is not symmetrical, we have to perform the gag test. The gag test is simple, so you can close and turn this side. Yeah, thank you. Gag sample is simple. We can use a spatula, tongue depressor. We have to insert the tongue depressor and touch the vulva. The patient give a reflex which is called a gag reflex. Can you turn this side? I am going to touch your vulva using the spatula. Say okay. Gag reflex. Cranial nerve 11 is accessory nerve. For that, two muscles are important: sternocleidomastoid muscle and trapezius muscle. Now I'm going to perform the test. You just turn your head left side. Yeah, for that the main purpose is you turn towards the left when I applied the pressure. The help of the sternocleidomastoid muscle. Now you turn towards the right side. Yeah, this left side sternocleidomastoid give a great pressure to turn the head with back support from the trapezius muscle. At last we are going to see cranial nerve 12, which is called hypoglossal nerve, which is the main function on the tongue. For the assessing the hypoglossal nerve, we have to tell the client to show the tongue outside. So can you show the tongue outside and move the tongue to left and right? Okay. So hypoglossal nerve is functioning is good. In case if the tongue, thank you sir, enough. In case the tongue deviates one side, that side the hypoglossal nerve is under function. In case the tongue deviates one side, that side the hypoglossal nerve is functioning is not correct. So the functioning side dominates over the non-functioning side. For the stroke patient, we can assess the hypoglossal nerve function is good or not. Okay, thank you. Thank you, sir.
So good evening. My name is Dr. REENA. May I know your name, please?
My name is Kishore.
Okay. Let's sanitize our hands first. So today I will be performing some tests to check your cerebellum and sensory function. Is that okay?
Okay.
So first we begin with the cerebellar testing. Our first test is finger nose finger test. So before that I will be holding my index finger over here. You have to bring your index finger and touch it and then touch your nose. Is that clear? So please proceed to the step. Okay. And our second test is rapid altering movement test. For that, you have to make the rapid altering movement on your knees by tapping them, and you have to place the palms swiftly, then back side of your hand, then you have to make it as swift as fast as you can. Please do the same. Okay. So our next test is heel to shine test. For that, you have to take your one part of your leg on the anterior tubular surface of the other leg and do a swiftly movement like this. Do it. This side. Okay. For next, I am going to check your bike. For that, you have to walk across the room for some time. I will be observing your posture and your hands free by your side. Okay, please walk. Okay. So our next is stand-up walking. So you have to walk like this. Now walk. Okay. Now walk on your toes like this. Okay.
Now we will be testing your sensitivity to vibration. I'll be striking this unit for and placing on the body prominences, and you should tell me if you feel the sensation. I'll be testing your position. For this, I'll move your fingers up and down. You have to close your eyes and then this movement I'm performing, okay? So, this is up and this is down, okay? Close your eyes. Okay. Now, I will be testing for particle and discriminative forms of sensation. So, we begin with a 2-point discriminative test. So that I will be using this paper clip. I place it in certain place in your hand and have to tell me 1 punch or 2 punch. Okay, now close your eyes.
1, 2, 1, 2, 1, 2.
Okay. For point of localization, as we placing the tip on certain place of your hand, you have to tell me where did I touch. Okay? Close your eyes. Okay. Close your eyes. I will write certain numbers or letters. You have to recognize what is written. Okay?
Okay.
Close your eyes.
Yes. 3, 1, C.
Okay. Now for extensive phenomena, you will close your eyes. I will touch you with my index finger on one or both sides of your body. You have to tell me it was one side or simultaneously both sides. Okay? Close your eyes.
One side, both side, one side, one side, both side.
Okay. So that's all for cerebellum and sensory testing. Thank you.